Thanks, Heather. And Robin, let's start with you. So we're just doing the top need, either substance abuse or mental health.
Julie, did you want 5 or just one of each?
Just one. We're gonna do one, and then if there's any that haven't been said by the time we get to everybody's had a turn, then we'll come back.
Okay. So I'll throw this one out as mental health, social engagement for people with mental health issues, and then for both, and this can be for A and D, quicker access to outpatient care.
And you're saying that's under substance abuse and mental health, quicker access?
It could be both. Both of these we look at them together because 50% of people with a mental health issue are going to have a co-occurring substance abuse. So.
Angie, top need.
I put down there rapid response to get people into treatment. It's you can get, even if some people just need to get into that inpatient substance abuse treatment, and when they're ready to go, they're ready to go. So, and then for the mental health side, I put support for children and parents, because these school-age children are not able to, if they're remaining at home, we don't know what's going to continue in terms of the schools reopening, but both the children and the stress that's creating for their parents.
Thank you, Angie. Dia, top need in substance abuse or mental health, or both? Please state which one.
Sure. In mental health, I would say the ongoing need for crisis call and outreach as we persist in this pandemic. And in substance abuse, and I can't remember if somebody's mentioned this, but the reality of the social distancing requirements have reduced the residential beds for substance abuse in particular. And so I would say residential beds in substance abuse.
Evelyn?
Additional housing, this could go for both sides. Additional housing for transitional youth and adults with supports.
Thank you, Evelyn. Bill? I think that's you. Top need. Bill, are you still on the line?
Bill was the 6'2".
Yeah. So just if you don't have something unique, if it's already been reported out, you can also pass. I think Susan Mee was also on the phone.
Yeah, I'm here. I like what's been said. I don't know if some of the programming is going to help with the children's crisis services on the MH side. That's, a concern. Housing obviously is an issue on both sides. One of the things that, and Elliot, I don't want to steal his thunder, but he's focused a lot on the workforce shortage issue. And I know that's that's something that relates to a lot of different issues, but I think it's probably worth mentioning that that's a real systemic issue.
So workforce on both sides?
Yeah. Probably even more so on mental health, but others might speak to that.
Dalmies? Top need?
Okay, so I did not divide them. I don't know. They're for both mental health and substance abuse. One that I haven't heard mentioned is the whole law enforcement interactions with people with mental health needs. And in terms of a priority, I would say to try to diminish mental law enforcement getting involved in crisis calls. To avoid all the things that we know happen. And also, just I agree with the whole increasing the workforce for both areas and maybe creating incentives for people who are looking for careers so that they would get scholarships and stuff to study fields in that area, careers in that area.
So incentives, a need is to incentivize joining the workforce.
Right. And to that, I would add to have a intentional goal on recruiting people with from different backgrounds, culturally and linguistically.
Mm.
And that's it for me.
Great.
I think that last one is especially applicable for our region, just to say that.
Heather, could you add, so after incentivize diverse recruitment into the workforce? Thank you. Elliot, unique need unstated so far on either side?
Okay, well, I'm gonna say it maybe in a different way about the workforce shortage on the mental health side. I mean, it really is both, but I'd put it on the mental health side is I think we need clear data regarding our behavioral health workforce. So if we're looking from a Region 4 lens, I would like to know how many of every kind of behavioral health provider do we have? How many students do we expect to come in? And we just need to start with some getting that data, making that available to planning and policy councils, and being able to use that to develop a strategic plan. On the other side, I think I'm really pleased to hear about all the work being done to expand medication assisted treatment, or MAT, and I applaud that. And I think we need to underscore that. I think I would love to see the numbers on, for our region specifically, and statewide, how many providers do we have? What is the need compared to how many providers we had, and those kinds of things. And I want to say something that hasn't been mentioned related to that is, I've never heard anybody talk about pharmacies here, but there is blatant discrimination that occurs regarding MAT, especially with Suboxone and buprenorphine at pharmacies. And I know for certain that there are pharmacies from major grocery chains and pharmacy chains in our region that either they just don't carry buprenorphine products because it's a pharmacist moral decision. They don't want that kind of clientele, is what actually a member of a pharmacist from a major grocery chain told me. And then another pharmacy has quotas and they won't allow other patients once they get to a certain amount. So someone could potentially get a script for buprenorphine, call around to 2 or 3 pharmacies, be turned away from all of them. And I'm not sure if anybody would agree, but I think I know what that person might do then.
Right. Yeah. So pharmacist discriminating against MAT clients, basically.
Yes, both both the overt and those that may not be so much, but it's still causing discrimination.
Thank you, Elliot. Erica, unstated need on either side, substance abuse or mental health?
Yes, one of the things for substance abuse is transportation services for those who would like to attend community IOP. I know that agencies do provide, but it's usually in a certain radius. So therefore, if there could be a need for those in surrounding counties that might only be able to attend in certain areas where that agency is not providing services, I think that would be beneficial.
Thank you, Erica. Evelyn, unstated need on either side, substance abuse or mental health?
On the mental health side, older adults that now not only have the mental health issues, but also have the aging physical crisis going on. And many times the licensed mental health homes cannot take people with certain physical conditions. So we're running into some real problems trying to get people who have the mental health and the physical conditions and getting them in the right houses with the right support. And our fortunately, our population is aging and they're living long enough to have some of these physical things going on, but we don't have the system set up for them.
Thank you, Evelyn. Jack, unstated need on either side, substance abuse or mental health?
This has already been said, but just expanded recovery housing and for the obviously mental health side and I mean physical and I mean not physical, substance abuse and mental health side. Also more crisis services, mobile crisis more specifically. And that's really all I have that hasn't been. Yeah.
Thank you, Jack.
Thank you.
Jan, unstated mental health or substance abuse needs?
Yeah, got it. Somebody needs to mute there. I wanted to respond there. I just took a look at MAT providers for the person who was asking how many MAT providers are there. There are 250 providers in network for AmeriGroup right now. So I have to assume it's the same for the other MCOs. And I can remember just a couple of years ago, it was about 25. So there's been a huge increase in recruiting and training and monitoring those providers. So the providers are there. It's linking our members to them. So my two suggestions would be, one of them I see as a legislative, it's in the summary that there's a bill that the PA needs to be removed for MAT. It is just an excessive barrier that doesn't need to be there. I mean, if things were more, I think that needs to be removed. So that's the first thing. And the other is under sober living options. In addition to increasing, the other problem I see is that a lot of people don't have that front end money. So I think grant money for that first couple of weeks for sober living, I think would be invaluable, because so many times members don't have that front end money to pay. And sometimes sober living places will loan you money. And so these are like halfway houses where you have to pay. And sometimes they won't, but I've always said if we could just get some good seed money, the return on investment there would be huge, because people have to get up and, they've got to get to work. But when they come in, they don't have a job when they get there. So they don't have that, unless they have, a wealthy family member or somehow getting some assistance, that they need that help getting into the sober living.
Thank you, Jan. Patrick, unstated need on either the substance abuse or mental health side?
Yes, mine could be for both sides as well. Housing with support. Most of the individuals that have to go in housing or like to go into substance abuse housing or dual diagnosis housing, there's not a lot of support. Most of them have a minimum income. But again, as I mentioned earlier, affordable housing we don't know what affordable housing is anymore in Region 4. that's why I say with support, beds, housing, and support for those that are in recovery housing, also mental health homes.
Thank you, Patrick. Shara, unstated need on either the substance abuse or mental health side?
I'd say for the mental health side, I just wanted to add to the comment about the law enforcement. I think increased education and support, or continuing education support regarding trauma, all types, but specifically for our area, the historical and racial trauma. That's something that's missing in the police training. And kind of going along with the support, the housing supports, just increasing actual case management or utilization of peer specialists in supportive roles for individuals.
And was that on the substance abuse side or both?
That would be for both.
Okay, so increased case management and peer support.
Yep.
Thank you.
Thank you.
Gary, any unstated needs that you see?
No, I don't have anything to add.
Thank you, Gary. Tristan, any unstated needs?
Not that it's key, that everybody's pretty much covered it. Did you hear me?
I'm sorry, you're really muffled. I can't hear you.
I would just be restating what's already been put up.
Okay. Tristan was stating what's already been said.
Okay, all right, thank you. And then Willie, any unstated needs for either substance abuse or mental health?
And Julie, while we're waiting, I'm going to ask Kirby. Kirby, when the time is up, will we automatically get cut off, or what will happen as?
No, you won't automatically get cut off.
Okay. I know sometimes other meetings are scheduled immediately in the time frame.
No.
So I wanted to make sure. Okay, thank you.
I don't have anything after this, so you're
Okay,
good.
Good. Okay, thank you.
Robin, I'm sorry, I know we're not getting you your
That's okay. That's okay. I just wanted to make sure. And so what we're doing is important. But I just wanted to, in case we run over, I just wanted to make sure.
So any other anybody I missed, and please feel free to speak up and share now, or anything that is unstated, so not already on the list, that you want to make sure gets added before we go.
Julie, this is Dia Cirillo, and I think it was very interesting today to hear from members across the committee about the acuity issue given COVID-19 under mental health. And I think that's true nationwide. I would imagine this would continue through the pandemic, and which means that increases demand and expands, really the client groups that folks see. I think the issue is how to manage, acuity and complexity during the pandemic. What's the strategy? What's the approach? How are resources being realigned?
And I'd like to add to what Dee is saying to include those resources, making sure that we're looking at the involvement of law enforcement and law enforcement, beds, workforce shortage, the whole thing falls into that. So I think that's, I agree with that.
Any,
This is Elliot. I have a few more that I don't know if are completely there. And I've heard a few comments about criminal justice reform, and I think most in this group know how passionate I am about that issue. And I feel like we could go ahead and put in here funding for, I'll use the term creative, but creative mental health crisis response. That's in terms of law enforcement, either co-responding models with mental health professionals and EMTs with or without law enforcement. And many of these models are successful without law enforcement, except in certain situations. But I think we would be well served if Nashville and our community in Davidson County would try that. So that's one thing. Funding is needed for that to happen. I'm not sure if we've said it, but increase reimbursement for providers just across the board. Reimbursement lags, and I can't go into all the data on that in this call with the time, but we need more money to pay providers through insurance contracts, through any means possible for crisis services, et cetera. I really would like to see that we find a way to develop a youth crisis stabilization unit or other similar services that youth that are not ready for the adult services can access. We're just going to have a lot more trouble with teenagers having a lot of issues and not really having places to go. And on the substance abuse side, it's already been mentioned, but same day access is what I would say instead of quicker. I would like to see same day access to levels of care that are needed. Thank you.
And Julie, I think I may have one more. I don't know if I heard this or not. Housing and services for the duly diagnosed with mental health and intellectual disabilities. That is something that we are seeing. We see it both on the housing side, and then there seems to be inconsistency in and a lack of treatment providers for that population.
And Julie, this is Evelyn. One thing I would like for us to look at, and Elliot kind of sparked this in my brain, was when we look at maybe increased amounts for the providers, that we look at these licensed group homes that are operating off the very minimal. And since there are clients at home now, 724, it has really strained their staff. If it was some kind of reimbursement they could get, because of the level of work they're doing, because they're keeping people out of the hospital. They're there 24 hours a day now with their clients, but they're not getting anything extra.
Thank you, Evelyn. So increased reimbursement for case management services?
No, for housing providers.
For increased reimbursement for housing providers. Anybody else? Okay. So hearing none, thank you all so much for hanging in with this process. I think you did a great job and have a great list, and are all doing such important work in this community. Thank you so much to Heather too for typing this up for us, and Robin, I'm sorry we went too over, but I think there's good information to go into the next step of the prioritization survey.
Well, and Julie, thank you. Thank you for coming out again to do this with us. We do appreciate this. We think it makes a real difference in the development of the needs assessments and hearing everyone. So thank you, and I will look forward to getting together with you and Angie to help distill this. And then for everyone that's here, I want to make sure that anyone that didn't get in on the initial roll call, could we stop the sharing of the document? Thank you, because I want to be able to see who we've got. So I know there were some of you that came on after the initial roll call. If we didn't have you call out, would you please call out now? For roll call, and while you are calling out, I will also say, if you have any brief announcements, I know that we are welcoming back Tristan today, and if you'd like to make a brief announcement as to what you're doing, we'd very much appreciate that. Domis is new, Dia is new, and so I want to recognize some of those people. I don't know, this is, we've had Shelby a meeting or two. So, at this time, if you did not get in on the original roll call, please, Willie, I don't know that we had you. Gary, Rusty, if you'll make note of that. Willie, Tristan, I don't think they were in on the original roll call. I'm not sure that Erica, did you make it in? So I just want to make sure that.
Yes, this is Erica. I did.
Okay, great. All right. All
This is
right.
Elliot
Yes.
Pinsley with the Behavioral Health Foundation. I didn't make it in.
Thank you, Elliot. I know that Kirby had gotten you after that. I want to make sure. All right. I think I think we're pretty good, guys. I want to thank everyone for sharing, for participating, to the degree that you did. Thank you so much. I think we've gotten some good information, and as a committee, we will get back to you. Thank you very much. Have a good day, everyone. Bye-bye.
Bye. Thank you.
Thanks, Robin. Bye.
Thanks, Avis. And